Patients struggle with dentures a lot, and the reason they struggle with them is because they're soft tissue supported, meaning that they rely on the gum tissue and the supporting bone to hold them in place. So what ends up happening is patients have to learn how to use their facial muscles and their tongue to make that denture stable, specifically the lower denture. Most denture wearers absolutely hate their lower denture and can generally get by with their upper denture at some level. That's where we start. We say, how functional are you with the restorations, generally dentures in this case? How functional are you with them now? What can you eat? What can't you eat? And let's make some decisions based on that. It's actually very easy to convert existing dentures. And the way that you do that is you create an implant-supported prosthetic that relies on those dentures. And there's two choices in doing that. You can make that prosthetic, or that denture, so to speak, it can be removable where it snaps onto implants with vinyl attachments. The patient continues to wear them like they're used to, where they can take those dentures in and out, but when they seat them, they're stable. It makes all the difference in the world. There's two approaches there. With a lower cost option, you can do it with 2 implants. The challenge with 2 implants on the lower denture is that there can be some rocking front to back, but that's still a tremendous advantage compared to what an existing denture without implants would be. If you add 2 more implants, or there's a total of 4, that denture no longer rocks. It's actually very stable from front to back, and people with a lower denture that has 4 implants, they can chew and eat generally whatever they want. On the top, the way we describe an upper denture when it's implant supported, you have the same choices. If you go with 2 implants to save some cost, that will make that denture relatively stable. There's a potential for a rock. What I mean by that is it moves or teeter-totters a little from front to back. When you add 2 extra implants for a total of 4 implants on the upper arch, you can literally, and this is the best thing that patients love the most, is you can cut the palatal portion of the denture out of the way. So patients get to feel the roof of their mouth again. They can feel a little papilla area right between where their front teeth used to be, where a nerve exits, to allow them to detect temperature. One of the biggest things that patients with dentures struggle with is detecting temperature when they're drinking coffee or those types of things. So the beautiful thing about 4 implants on an upper arch to actually stabilize a denture is you can remove the entire palate of that denture. The patient gets to feel the roof of their mouth again, and life becomes a whole lot better.